Guys, welcome to another video. Today our topic is on bone cancer. We will be covering a short module on bone cancer in general. We'll start off with the risk factors, treatment options, and the symptoms. So let's get started. Now, bone cancer is a relatively rare type of cancer that starts in the bone tissue. It can develop in any bone in the body, but it is most commonly affects the long bones of the arms and legs. There are several types of bone cancer, each with its own unique features and characteristics. Osteosarcoma is the most common type of bone cancer and usually affects children and young adults. It often develops in the bones around the knee, but can also occur in other bones. Chondrosarcoma is a type of bone cancer that develops in the cartilage cells and is more common in older adults. Ewing sarcoma is a rare type of bone cancer that usually affects children and young adults. Other types of bone cancer include chordoma, osteoblastoma, and giant cell tumor of the bone. Talking about bone cancer, there are several risk factors that are associated with bone cancer. First off is age. Bone cancer can occur at any age, but it is more commonly diagnosed in children and young adults as well as older adults. Next is gender. Certain types of bone cancer, such as osteosarcoma, are more common in males than in females. Third is genetics. Genetic factors can play a role in the development of bone cancer. Certain genetic conditions, such as Li-Fraumeni syndrome and hereditary retinoblastoma, can increase the risk of developing bone cancer. Fourth is exposure to radiation. Exposure to high levels of radiation, either from medical treatments or environmental factors, can increase the risk of developing bone cancer. Paget's disease is a condition that affects the bones and can increase the risk of developing bone cancer. Previous cancer treatment. People who have undergone radiation therapy or chemotherapy for other types of cancer can have an increased risk of developing bone cancer. Bone marrow transplantation. People who have undergone bone marrow transplantation have an increased risk of developing bone cancer. It is important to note that having one or more of these risk factors does not necessarily mean that a person will develop bone cancer. Many people with these risk factors do not develop bone cancer, while others without any known risk factors can develop the disease. However, it is important to be aware of these risk factors and to discuss any concerns with a healthcare provider. Your healthcare provider can help you assess your individual risk of developing bone cancer and recommend appropriate screening and prevention measures. Now, the symptoms of bone cancer can vary depending on the type, location, and stage of cancer. First off, we have pain. Bone cancer can cause persistent, dull, or severe pain in the affected bone or joint. The pain may worsen at night or with activity and may not be relieved by rest or pain medication. Second, we have swelling. Now, bone cancer can cause swelling and tenderness around the affected bone or joint. The area may feel warm to touch and may appear red or inflamed. Third is weakness. Bone cancer can weaken the affected bone, making it more prone to fractures or breaks. This can cause sudden pain and limited mobility. Fatigue. Bone cancer can cause fatigue or tiredness, especially if the cancer has spread to other parts of the body. Unintended weight loss. Now, unintended weight loss can be a symptom of advanced bone cancer, as the body may be expending more energy to fight the cancer. It is important to note that these symptoms can also be caused by other conditions. So it is important to see a healthcare provider for an evaluation if you are experiencing any of these symptoms. Early detection and treatment of bone cancer can improve outcomes and reduce the risk of complications. We have this treatment. The treatment for bone cancer depends on the type, stage, and location of the cancer, as well as the overall health of the patient. Treatment options include: first is surgery. Surgery is often the main treatment for bone cancer. The goal of surgery is to remove the cancerous tumor as well as a margin of healthy tissue around it. In some cases, amputation of the affected limb may be necessary. However, whenever possible, limb-sparing surgery is preferred to preserve function. Next is radiation therapy. Radiation therapy uses high-energy radiation to kill cancer cells and shrink tumors. It may be used before or after surgery or as a primary treatment for bone cancer that cannot be removed surgically. In some cases, radiation therapy may be used to relieve pain and other symptoms of bone cancer. Third is chemotherapy. Chemotherapy is a type of cancer treatment that uses drugs to kill cancerous cells. It may be used before or after surgery or as a primary treatment for bone cancer that has spread to other parts of the body. Chemotherapy is often used in combination with other treatments such as surgery or radiation therapy. Fourth is targeted therapy. Now, targeted therapy is a type of cancer treatment that uses drugs to specifically target cancerous cells and their growth mechanisms. It may be used in combination with other treatments such as surgery or radiation therapy, or as a primary treatment for bone cancer that has spread to other parts of the body. Fifth is immunotherapy. Now, immunotherapy is a type of cancer treatment that uses the body's own immune system to fight the cancerous cells. It is still an emerging approach for bone cancer treatment, but research is ongoing. In addition to these treatment options, supportive care such as pain management, physical therapy, and emotional support are necessary components of care for people with bone cancer. A multidisciplinary team of healthcare providers, including oncologists, surgeons, radiation therapists, and supportive care specialists, work together to develop a treatment plan that is best suited for the individual patient. Thank you guys for watching. Remember that early detection and treatment are important for improving outcomes in bone cancer. If you or someone you know is experiencing symptoms of bone cancer, such as persistent bone pain or swelling, please seek medical attention promptly. With proper diagnosis and treatment, many people with bone cancer can go on to live healthy and fulfilling lives. Thank you guys for watching. I'll catch you in the next video.